Hi, everybody. I'm Neil from Your Gray Matters. Welcome back. This week, we're going to take on a really tough topic. Here's a question for you. Does your oral care, does your oral health affect your overall health? How about you, your kids, your grandkids? What's the correlation between what you're doing in your mouth and your overall health? Stay tuned. This is a great podcast. Hi, everybody. I'm Neil from Your Gray Matters. Welcome back. We're so glad to have you. And as you know, whether you have dark hair or gray hair or red hair, but come on, we know what's under there. We're glad to have you. And today we're going to delve into a serious issue. You know, our show is about solutions and miracles that already exist, but you may not be aware of them. And we're going to dive into dental care today. Your dental health, your kids' dental health, your grandchildren's dental health. Why is it important? Is it a priority? Should it be? I'm really excited. I have two guests today. I haven't done that before. I have Dr. Bryan Waxman and Dr. Jaclyn Chin. Hi, guys. Thanks for coming on. Appreciate you.
Thanks for having us.
Do you guys mind if I call you by your first names?
Not at all.
Of course not.
Great, great. Now I'll let you, viewing audience, figure out which one's Bryan and which one's Jaclyn. So when I was thinking about dental health, guys, and everybody, I was thinking about priorities. And I remember years ago, a professor of mine said to me that when you need to get to work, when you need to do something that's important, and your car breaks down, and that's your method to earn money by getting to work, if something goes wrong with that car, you find the money. Could be fixing a flat tire, but it could be a blown engine. It could be a brake job. It can get expensive. That becomes a priority. The question is, does dental work in your mouth? Does having a healthy mouth in your mouth, your children or your grandchildren's mouth, is that a priority? And should it be? And that's what we want to explore today. I'm really excited, as I said, to have two really special dentists on today who are going to help us to climb to some answers with this show. Let me tell you about Jaclyn. What I want you to listen to, everybody, is the amount of work and time that our dental leaders put into becoming educated to make our lives better. Let me tell you about Jaclyn. So she graduated with a Bachelor in Science from the University of Western Ontario in 2005. And she completed a DDS, which is a Doctor of Dental Surgery at U of T in 2009. But then she went on and took a one-year advanced education in general dentistry at the University of Michigan. And she focused on assisted design computer manufactured dentistry, CAD/CAM. You know, on this show, we look for miracles that already exist, solutions. That sounds like one. We're going to find out what that is. She went back to her school. She joined the University of Toronto Admissions Committee, helping other people get into the field. She even served as secretary of the University of Toronto Alumni Board of Directors, and she's currently on the executive committee of the West Toronto Dental Society, and on and on and on. She's also a member of the Ontario Dental Association, the Canadian Dental Association, the Crown and Bridge Study Club. I actually thought that was cards. She plays bridge, but it's not that. And she's a mentor to a ton of students and to her own patients. Bryan Waxman is a certified specialist in dental anesthesia in Ontario. So he's an anesthesiologist and he's a dentist. Imagine the amount of time to get ready for this. He also went to Western Ontario. He graduated with honors in 2005. He went on to University of Toronto. He also graduated with his DDS in 2009, and he won all kinds of awards and scholarships. When he was finished with that, he went back to school. He pursued a residency in dental anesthesiology at Stony Brook University on Long Island, New York. He in a tertiary care facility. We're going to find out what tertiary care is. And he was chief resident in his senior year. He's a 10-year clinical instructor at U of T in Toronto for graduate anesthesia residents in the Pediatric Surgery Center. By the way, did you guys know that you did all this? You guys are amazing. And I'm going to tell you something about both these doctors. They carry huge credentials. Bryan as a DDS, Jaclyn as a DDS, Bryan as an anesthesiologist. Jaclyn is a specialist in different types of technology. And together, what they offer to us as a society with all of our dental professionals is a way to keep our health in order. And right off the bat, I'd like to talk about that, guys. And again, thanks for coming onto the show. When I talk about parents, when we're doing the kids part of this, I mean any caregivers for kids, parents, grandkids, those who are overseeing kids. So here's a question. I've actually heard what happens in the mouth does not necessarily stay in the mouth. And I'm curious to know, the oral health, is it related to our overall health? And if so, how's that? I'm going to let you guys jockey for who wants to answer.
I'll let you go first.
Definitely, oral health is very much linked to our overall health. The bacteria in our mouths can enter the bloodstream and affect different areas of the body.
Wow.
So there have been studies that have shown a link to Alzheimer's, stroke, heart disease,
Wow.
diabetes.
I think it's more of an association than a causation, though, which means, I think that there's a lot of study in this field by scientists, researchers, to try to see how significant a direct causality is between these organisms in our mouth and all the, pathologies that Jaclyn had mentioned. So, but there's no direct link, but definitely a very big association between periodontitis and other sort of diseases.
So what you're basically saying, and if we can go to basics, you really should brush your teeth. You really should floss. You really should have regular checkups. And I imagine that you should eat properly. So we'll get into that stuff. Thank you for that. Bryan, Bryan, let me ask you, what is dental anesthesia? I'm wondering why you pursued it, how it helps the community. Please talk to us about that.
So dental anesthesiology it's an interesting field in dentistry because, anesthesia is sort of shared between medicine and dentistry. The dentist, of course, we have to self-advocate and say anesthesia, like general anesthesia, was discovered by a dentist in Massachusetts, but that we don't want to discredit anybody on this podcast. So we'll say it's even Steven with the physicians. But, dental anesthesia is a real important specialty, in my opinion, obviously, in increasing access to care, treating patients out of a hospital facility, especially as we know in Canada and in Ontario. I can speak more specifically, hospitals are overrun with patients, surgeries are backlogged, all surgeries, right? And dentistry, you'd be surprised, happens to be a major operating room time user. So especially for children, yes, and patients with special needs, right? So who need to go to sleep for their dental care. So I think dental anesthesia is a really important service, whether it be a physician traveling or us dental anesthesiologists in the community, to reduce that backlog, keep patients in my opinion, a more comfortable setting in a private office, and increasing access to care for children, really phobic adults. So there's a lot of that. Dentistry wasn't done how it is now back in the day. So there's a lot of adults who really depend on the service to have their dentistry done asleep. And then the special needs community, I would say, are the major ones. And obviously oral surgery, right? Oral surgeons also provide anesthesia as well for wisdom teeth or any complex procedures as well. So I would say in the general scope, that would summarize the importance of dental anesthesia.
So I guess it really helps people who have great fear, if they're nervous or if they have these challenges that you mentioned. It's safer for them. It's more efficient. It makes people sleep while they're getting their dental work done. Gee, that sounds good to me. I'm going to try that next time. Let me ask you though, you must have more than just you when you're doing anesthesia. It sounds to me like if I watch TV, when I see somebody having an operation, there's a lot of people in the room. How does it work with you? Are there a lot of people in the room?
So specifically in Ontario and the model of care, we call it procedural team anesthesia. I should specify that as a more general scope, there are multiple models of care. And so the one you're probably referring to that you'd see on TV shows and movies and stuff like that would be, a sole anesthesia provider model with a separate surgeon
Right.
and multiple nurses, clerks, operating room staff, personnel. For dentistry in Ontario, we have a very unique model. It is practiced in other areas in Canada as well, but it's called procedural team anesthesia, where the anesthesiologist and dentists, such as myself, provide the general anesthesia care as well in conjunction with a critical care trained registered nurse or respiratory
Wow.
therapist, and then another specifically trained dental assistant. So there is a minimum of 3 people in the room, as well as recovery room critical care trained staff as well.
Wow.
But for me, I would do the dental work in conjunction with the anesthesiology with my advanced care monitoring of a registered nurse or respiratory therapist.
Wow.
So there's multiple ways to do it, yeah,
Yeah,
safely.
a lot to it. And I imagine that they're outpatients. I mean, they don't stay overnight in your clinic, I imagine.
No, anesthesia is really, really special now with the medications available to us. The hangover, quote unquote, is much shorter.
Mhm.
Medications are very short acting, very, very good for patients to feel better later in the day. Most, at least children, it's hard for parents to keep them, in recovery phase later in the
Yes.
day. They want to run around and play as normal, despite our instructions saying,
Don't
try
do
to reduce
that.
activities today. Yeah. So, whereas adults, obviously, things take a little longer, but most people are going to work the next day in school, and it's pretty amazing and out of the
Wow.
office within an hour after the procedure.
That's fantastic. I'm so glad that you explained that to us. Thank you. Let's turn our attention to our children and our grandchildren. And let's start with children's dental health. Could you, the two of you, share why it's so crucial for parents to pay attention to their kids' oral care? Either one.
Well, cavity is one of the leading diseases in children, if not the most prevalent disease in children.
Okay.
So, monitoring that is very important because, as we know, unlike other things, cavities don't really hurt until it's far too late. So, we need to catch these things early. Prevention is key. So, also education. I very much believe that good experiences at the dentist start very young. When
Mhm.
you're little, you don't have any issues. You get used to seeing the dentist. The dentist becomes a happy place to be. And we can make sure, keep you on track and make sure that you're not there for a negative experience in the future.
So you brought up cavities, Jaclyn. If you don't mind, can we explain to people what's tooth decay? What's going on when somebody has a cavity?
So when we eat sugar,
Yeah.
well, I should say everybody has bacteria in their mouth.
Okay.
When we eat sugar, that bacteria loves that sugar as a food source. And then they excrete an acid, and that acid starts to eat away at the enamel of your teeth and then
Wow.
into the next layer of your teeth. And that's what causes cavities. So if we don't eliminate the bacteria, if we don't take care of the acid or the pH in the mouth, it could cause cavities. So yeah, oral health is very important.
Wow. So incredible. And actually, I think that there's a misconception among parents, grandparents, and even I was guilty of this, is that baby teeth don't matter, but they must be serving a purpose. Can you explain to everybody why are baby teeth important to and have value?
So, in my practice now, I've actually limited my practice to kids. So I'll
Yeah.
field this one because it's something I see quite often. And just to in addition to what Jaclyn had said with the early intervention and early consultation with a dentist, What I see far too often is, we're told to breastfeed your children up until 2 years old. I think that's what the pediatrics physicians advocate for. Don't quote me. I'm pretty sure that they do say that though. But they don't warn that breast milk has more sugar in it than cow's milk. They don't warn that sleeping, on the nipple all night and getting that sort of high sugar source, which, yes, we think we're doing such a favor to the baby, and we are. But as kids get older, nutritionally, breast milk really does become supportive. They're eating food now, they're eating different things, and it doesn't have to be all night. And that's what I think is a big message that's being missed, and that patients don't appreciate enough, that they have to be wiping teeth at night. Don't breastfeed at night on demand. Try not to. Kids should be trying to sleep through the night after 1 years old. Becomes more of a comfort than it does a source of nutrition. And I see this a lot in my practice when I see kids needing general anesthesia under the age of 2 or around 2. And we have to also remember, I think it's important to state, and Jaclyn had mentioned saliva and just the importance the saliva has in protecting teeth. Our saliva goes down to nothing at nighttime. We're not eating. Our brain knows it doesn't need the waterworks in our mouth to digest food. It doesn't need the waterworks to clear food out of our mouth. So in a dry environment, the milk just tends to sit there. And so whether it be a bottle or breast milk, it just sits there all night and creates a perfect environment for all these bacteria that Jaclyn had mentioned to create these acidic holes in teeth.
Wow.
So I think that's crucial. And then back to your question just about, development and long-term effects of cavities or any negative effects of having decay at a young age. Baby teeth are extremely important for multiple reasons. I'm used to giving this talk because I do it every day in a consult. And because, parents do want to find value in restoring baby teeth, especially under general anesthesia. So, I think the most important things to say is we need to chew. So if we start to get cavities and we start to get pain and lose teeth, chewing efficiency becomes poor, even for a child who's missing teeth, especially at younger ages. And number 2, there's a consequence to early tooth loss, which is the other teeth tend to shift and move. And we start to get these issues of not being able to accommodate the permanent teeth later. So because baby teeth are silly, they always look for their neighbor for some reason. That's just the way they're made. And so they always close into the spaces, and the new teeth and all the other permanent teeth are coming into the wrong positions and can cause real sort of, we call it a malocclusion. It's a way of saying we're just not developing in a strategic way any longer. And the orthodontist has a lot of work to do at that point later. Also, we just don't want to avoid pain, infection, right? Treating decay while it's small or preventing it in the first place. You don't want your kid to suffer, right? Or ever have pain. And you definitely don't want infection, because although infection in the mouth traditionally is small, or a little bubble around a tooth, it can spread like any infection in the body, which is, a big concern, especially to the eye or to spaces that it can travel into the body and cause bigger problems.
So what you're saying is care of baby teeth can actually have an effect on that child all the way into their adulthood and for their whole life.
Absolutely. Not to mention the aesthetic component. Some kids
can be affected.
And also just kids psychosocially. Some kids are more sensitive than others, when front teeth are lost at an early age. So there's multiple factors.
So even your confidence and your own self-respect can be affected by how your mouth is looking and working. Wow. Yeah. Fascinating, folks.
I will add one thing to what Bryan said about breastfeeding. That goes for all types of sugar. So that type of mentality should be conserved throughout life. So we always say eating 10 Skittles in 1 minute is better than eating 1 Skittle in 10 minutes. Because having that sugar completely bathing your teeth over a long period of time, that's going to put you at more risk for cavities than more sugar in a short amount of time.
Oh, so get it over with. You're saying get it over with.
Yes. So constant snacking, lots of sticky crackers, raisins. If your kid is always eating and never allowing that mouth to clear out, you're going to be at more risk for cavity.
Wow.
I'm going to piggyback on Jaclyn now. We're a good team.
I like this.
Also, keeping it to meal times
Yeah.
is essential as well, because as I told you, we have no saliva at night. For the same reason, when you're constantly snacking, our saliva actually goes up highest at meal times. Our bodies we have a rhythm.
Yeah.
So breakfast, lunch, and dinner is when our saliva increases, and our body says, okay, we're going to wash everything away. So snacking in between, or multiple sugar sources in between those times, also is a heavy contributor.
So you've talked about, really, I was going to ask you about habits for children, oral habits. We've talked about when to eat and how much sugar and that. Are there other things that we can do to protect our kids, dietary things, anything else that you might give to us as important?
Dietary wise, I would say it's always great to have a basic food after a high sugar food. So a glass of milk, some cheese, that will balance out the pH in your mouth. Or water. Lots of water after you eat. Get rid of all that stuff stuck in your teeth.
Wow.
What else? And habits like pacifier use, thumb sucking.
Wow.
There are skeletal consequences to those habits past the age of 3.
So how it even affects their skull, their mouth,
yes, it will cause you to develop a narrower palate. You'll have more skeletal issues.
Wow.
The
Wow.
habits should be stopped quite young as well.
Wow. Guys, this is so fascinating. And I'm glad that we talked about this, because I think honored ignorance. It's not that people don't care about their kids, but they don't know. And I guess the old saying of you don't know what you don't know really plays in here. So thank you for telling people. And I hope that everybody will take that to heart. I want to shift us over. Yes,
One more thing I have to add, because we left this out,
go.
and it just hit me like just toothpaste.
Oh, yes.
So fluoridated toothpaste.
Yes.
How do we leave this out, right? What kind of dentists are we?
Yeah.
So, the reality is that, there is mixed reviews amongst parents, I find, about fluoride, generally very accepting. But fluoridated toothpaste, I think the key message here is, especially at nighttime for young children, once they have teeth,
Yes.
the new thinking now in dentistry, it used to be not until 3 to see a dentist. First of all, I should specify. Now we're advocating first tooth in the mouth or at 1 year of age, whichever one is first. That's number one. And number two, fluoridated toothpaste is essential to the topical application of fluoride to the teeth is essential in strengthening the enamel, preventing decay, becoming more resistant to all these other variables, the bacteria, the acid attack, and all these other things, and the sugar sources. We want more resistant teeth, of course, as well. So professionally applied fluoride, but also at nighttime. And we advocate for just a little, when the kids are really young, they don't spit. And that's a big concern with parents. Just to use the littlest bit, like bring the brush to the toothpaste. Don't put the toothpaste on the brush, and just take a little rice-sized or pea-sized, I'd say rice-sized for under 3 and pea-sized amount for over 3, to just let it foam up and get in there and do its job, especially before bed. That is the key, to let it sit there. And one more piece of advice is, don't rinse out the mouth after. To rinse out, I do this. Everyone's guilty, because we want to get rid of the toothpaste in our mouth, right? That's like our instinct when we spit. Keep it on the kids' teeth. Let them just go to bed. Right? It's done. Dry spit, and then go to bed for the night, as the fluoride will stay.
Wow, that's fantastic. So thank you for that. Yeah, so fluoride plays a big role, obviously, in our health. Thank you for that to the both of you. So, like most kids, or all kids, hopefully, they grow up to be adults and they have teeth, hopefully. But the thing is, and I find it interesting because I know in my family, I'm glad I have my dad's teeth because I have really good teeth. My mom's teeth, not so good. I got other cool things from her. But the work on teeth is really, really important. We started this podcast talking about priorities. And obviously, we've been easily making the case that our overall health is related to how our mouths are, and therefore it's got to be a priority. Let's talk about oral health in all adults. They could be, I think you guys are younger than me, your age. I'm hitting 70 in a couple of months. Tell me, what are the main dental issues facing, let's say, the older generation?
So I always say, as we get wiser, our bodies change. And
What?
one thing that changes is our gums start to recede a little bit.
Hmm.
So the gums come down a little bit and our roots start to be less protected by these tissues and are more exposed. Also, our health changes a bit and we're on more medications. And then a lot of these medications cause our mouths to be drier. So,
Hmm.
like Bryan said before, less saliva, less washing away of the bacteria, less neutralizing of the acids in our mouth will increase your chances of decay. As well, the roots now that are showing, if you look at your teeth, you notice that the roots are skinnier than the crowns of your teeth. So
Yes.
the spaces between your teeth get bigger, more areas for plaque to get trapped. And also the roots of our teeth are not as resistant to decay as the crowns of our teeth.
Hmm.
So as we get older, there's the risk of decay is higher, definitely, and the risk of periodontal disease is higher. We have to take better care of our teeth, probably spend a little bit more time, use a few more instruments at night to make sure we get all of that plaque off.
Mhm.
So a lot of things change as we get older.
And it's interesting because I know in our house we have a proper toothbrush, we floss a lot, but also the something called the sulca brush seems to make a difference. So you're working on your gums, I've been taught. I guess it all plays a major role for the health of the mouth.
It does.
And
And also dexterity, arthritis. Sometimes we are not as able to take care of our mouths. So
right,
electric toothbrushes are very important.
okay.
That kind of armamentarium really helps with us as we get older.
So really taking care of our oral health as we get older, it can be a major player, as we said, to our overall health. And I've heard, I can't back this up, but I remember many years ago, a friend of mine who was in his 30s at the time actually had a minor heart attack. And they told him that it was from gingivitis, that had gone down to his system. Now, I don't know that I can back that up, but it did play a role in my thought process that keeping a healthy mouth healthy is really, really important. And
So, as
I
we
have,
said earlier, there's a association, not a causality. So
okay,
I would be weary to say it's because of the bacteria in the mouth that caused a heart attack. There's multiple variables to systemic disease. Family history is one of the most important for heart health. Diet, exercise, lifestyle, amount of plaque, medications, everything is, I think we're all sort of, a conglomerate of, things that can affect the heart. So I would be very weary to say it caused it, but did it have an association? If he had a lot of bacteria and the bacteria was constantly entering, or if he had constant infections, yeah, it definitely didn't help things. That's for
yeah,
sure. I
okay.
think I'm not there yet to say it caused
And
this.
I thank you for that. I mean, I raised it. It sounded kind of odd even to me, but I've wondered about this for years, how it could happen. But the message was the same. You got to take care of your mouth and your overall health was the
Yeah,
Well,
message.
everything's related.
yeah.
Sorry, sorry, Jaclyn?
Everything's related.
Yeah. So there is, as you said, everything's related to our whole system.
And also, I think it's important to know dentist, we say dentist, we don't say doctor of dental surgery, right? So, we sort of group things. I think everyone's a bit guilty, including myself growing up or anyone, to say, well, there's the dentist, there's the doctor.
Yeah.
And sometimes we don't group it into the same pool. So I think you mentioning these things is important to say that, yeah, it's all sort of, it's still part of us. It still affects other areas, despite it being with a different mental healthcare provider, right? Like, so, and I think like just in addition to before, some way my brain works, I just sort of listen and I take, I think we didn't mention increasing frequency of professional visits as you age,
Oh, yeah.
just to retouch
Yes.
up on that. I think that would be important for the audience to hear that, as we get older, I think the frequency of needing a professional application of fluoride on those roots, like
Yeah.
Jaclyn had mentioned, or cleaning in those deeper pockets and all those things become even more important as well. Sorry, I didn't want to be remiss and miss that.
No, and I appreciate that because I've been told, especially being diabetic, how important it is for me to have, I think I go at least 4 times a year, maybe more than the average person who doesn't have diabetes, for cleaning, for a teeth cleaning, for scaling, for looking in my pockets, things like that. And I've found since I've been doing that my oral health has been way better having that checkup.
And I think it's important for people to know that dentists are constantly in contact with medical doctors. Bryan talks to doctors all the time, and your medical health is important for us to know as well. So just like everything's related, I know some people come to the dentist and they don't believe that they need to tell us anything, or what does my heart health have to do with my oral health, or why do you, because we use drugs, we give you local anesthetic. We also are the people that look in your mouth a few times a year. We catch things as well. So it's really important for us to work as a team, the whole medical community.
We
Yeah.
also understand risk factors too, like you mentioned, Neil, which was, I think, a great thing to mention was diabetes. That we don't have causality from the mouth to cause things, but we definitely know what risk factors there are to having issues in the mouth. So diabetes is definitely a high risk factor for periodontal disease, smoking. So there definitely are more than associations for habits or systemic diseases towards having issues in your mouth.
You know, it's interesting, guys. I have close business contacts in the life insurance business and disability insurance business. And I've had a conversation unofficial just with some people who I know. But I think that if people can prove that they're getting regular dental care, in my opinion, there should be a bit of a discount on the premium for that insurance, the same way that it is if you're a non-smoker. That's my belief system, that if you're taking care of your mouth, somebody like the insurance industry should be acknowledging it. Just a personal thought. But
Yeah.
And you talked about things for us to do as adults. Is there anything else, any other tips that you can give, especially as we get older and I see some of my friends now having to replace their teeth or get partials or things like that. Is there anything else practically that adults can do to keep their mouth in good shape?
Neil, you're encroaching now on getting billed for this as a consult.
Yeah, well, we're going to come. Well, see, it's a priority.
I'm just kidding around. I don't know. Do you want to take that one?
Honestly, I think just like your main message in this podcast, it's overall health. So everything affects everything. And I believe if you take care of your body, if you eat well, if you drink a lot of water, you go to your regular appointments, if you treat yourself, your health as a priority, you'll be okay. Extra things to do, I mean, as long as you get into the dentist and you listen to you take what they say into consideration. I'm not saying you should always just do what you're told, but be an advocate for yourself and really educate yourself on your personal health, I think is a major thing.
Well, thank you for that. And I appreciate it. You know, a big part of this show is that we like to bring forward to our listeners interesting solutions that exist, but people may not be aware of them. I call them miracles, some of them actually that exist. And I wanted to ask you, tell me about some of the new changes that you've seen in dentistry. Could be technology, could be solutions. What comes to your mind that our listeners would like to know about?
Well, you do more. CAD can explain all that.
Well, over the last couple of decades, the major thing, like everything else, dentistry is going digital. So when I did my residency at the University of Michigan, that was the one reason I really wanted to go there, was because they were very advanced in computerized dentistry. So now, without getting too specific, but we can scan things. We have cameras, intraoral cameras that go in the mouth. So I think the beautiful thing that's happening in dentistry now is that if I see a cavity, if I see something going on, I can take a picture and you can see it as well. We can discuss it, we can educate you on it. You now can understand better your own health and the treatment options that we have for those situations. And I think education is key. The other thing now that's happening with computerized dentistry is, without getting too specific, crowns, anything we're making in the lab, instead of taking these goopy impressions that we were used to growing up. I just use a camera now, we can scan your whole mouth, which
Wow.
is great because not only is it a file that we can look at together, another form of education, but the accuracy is better. I feel like I have more control over what's happening, and just understanding and communication within the people at the laboratory or within the office, the communication is better, and I think results are better. We can even do smile designs now where take pictures of you and kind of give you an idea of what it's going to look like at the end, so you can actually see
Wow.
um,
Wow.
the possibilities. So I think dentistry is going in an amazing direction with technology. It's quite incredible.
Wow, that is just terrific. And I'm glad that you mentioned the crowns because I became aware that you can make them in your office. It's not like a long time waiting for that crown to arrive and then another appointment to put it in. And I love what you just said because see, folks, there are growing technologies, solutions, miracles that already exist. That's what we like to focus on. And frankly, the two people who are with us representing this great, great, I'm going to call it ability to help us have better health. To my mind, we owe a lot to our dentists. And I'll tell you, I'm thankful that I have good dental care. I just want to wrap this up very quickly and just say, so a healthy mouth is just not about appearance. It really does reflect our overall well-being. So I think it was easy for me to say the cost of brakes, putting in a new engine compared to the cost of dentistry at times. But the truth is, your mouth, your health has to be your priority, or you won't have a need for a car. And that's the way I see it myself. Guys, is there anything else that you'd like to bring to our attention before I thank you and we sign off today?
Yeah, just I think that stressing that, you know, yeah, you're right. Dentistry is sometimes cost prohibitive. And
Mhm.
I think your example with the car breaking down or anything like that. So I'll give a comparative example on maintenance and on, going for regular service
Okay.
appointments.
Okay.
That is the best way to avoid the brakes failing. That is the best way to avoid the engine breaking, is getting those oil changed, getting the filter changed, getting the engine air filter changed. I'm going through the list of what I have to do every time I
Yeah,
teach.
tell me about it.
Rotated tires, getting the pressure checked, all those things. I don't want to compare ourselves to a car shop, but really the concept is similar in
Mhm.
that dentistry is a lot of problems are preventable with education. I know we keep coming back to the same points, but they're important. Is education, professional maintenance and service, and that only we can see or do or catch early. X-rays, of course, we didn't even touch on that, when kids should get X-rays or this or that. But obviously, just by going and getting that maintenance, you're going to have those things checked and make sure everything is healthy. And then that is the best way to avoid your car breaking down. So, or
Yeah.
your mouth having major issues.
Well, I want to thank you both, Bryan and Jaclyn. This has been really enlightening. It's so important that people understand. I mean, even the comments that you made about baby teeth, I know for me is fascinating, but I thank you both. You're both such a credit to our society. We're lucky to have you, as with all of your dental colleagues. And folks, please take a moment to take care of your health every day. And with that, I will say thanks for watching today. We will be back next week on Monday, as we always are. Thank you, Bryan. Thank you, Jaclyn.
Thanks so much.
Hey, everybody. Thanks very much for watching today. We appreciate it. Please subscribe to our podcast. It really helps us grow and it makes us stronger, and we appreciate you doing it.